Hi everyone. Now the topic of discussion is on corticosteroids, the important topic in your pharmacology. So one of the important questions asked from your pharmacology in your basics paper is this corticosteroids. So let's discuss. Myself Dr. Saiti, Team MDS Conquer. So any essay question, if it is asked as an essay question, you have to write the contents. So the contents actually include the introduction, the synthesis of the corticosteroids, and also the diurnal variations, the regulation, and the actions of the the actions of the corticosteroids on the body, and the classification of the drugs, and the adverse effects, the uses and the adverse effects. So all and the applied aspects at the last, followed by conclusion and references. So these are the contents. So as we discuss, you can write the contents. Okay. So coming to the synthesis, so introduction, you can write that the corticosteroids play a very important role in regulating the body functions, like that. Any introductive thing or descriptive you want to put in, you can write. So followed by the synthesis, so it is mainly synthesized by the adrenal gland, so the cortex and the medulla. So you have to write these zones, and if possible draw this diagram. Okay, you have to write the zones and the individual things you have to write which are being produced by the individual zones. So that's important. So next you have to write the regulation. So if a person is in constant stress, either physiological or psychological or environmental, then the hypothalamus produces this CRH or corticotropin releasing hormone, which acts on the pituitary gland to produce the ACTH, that is adrenocorticotropic hormone, which again acts on the adrenal gland to produce the cortisol. Okay, this is the HPA axis which you have to draw. This diagram, if you draw, it will be really fetching and it will add marks to your answer. Okay, and if the cortisol levels are reduced, then the CRH, it sends a signal via biofeedback mechanism to the hypothalamus, and again it produces the CRH. So it is like opposite again. So increase in the CRH occur if the cortisol levels is low, and reduction in the CRH occur if the cortisol levels are high. It is how. So if the cortisol is more produced, then it sends a signal, so the CRH will reduce, and again opposite is like if the cortisol levels are low, it sends a signal, so that the CRH is more produced by the hypothalamus. Okay, this is the HPA axis which you need to draw, and you need to explain. Next, the diurnal variation, usually it is maximum in the morning hours, that is between 6 a.m. to 9 p.m. So again for the night shift persons, it's opposite. So again it's minimum in the evening hours. So actions of these glucocorticoids, so you have to write the individual actions. So protein metabolism, it is actually for the protein breakdown. So for the retardation of the growth, the thinning and of the skin and subcutaneous tissue. So muscles gets wasted if any the cortisol levels have to be in its own limit. If it crosses the limit, then it can cause more of protein breakdown, which causes wastage of the muscles, leading to the condition called as the steroid myopathy. And also it can cause the thinning of the hair and poor wound healing, and also very important role in carbohydrate metabolism. So this line you have to put forward for this, that it promotes gluconeogenesis and prevents the glycolysis. So this you have to write. Okay, this is very important. And then for the fat metabolism, so it causes a redistribution of the fat at the expense of the extremities and centripetal distribution of the fat. Okay, so because of which the extremities are thin, and since if it crosses a limit, it results in a condition which is called as a moon-like face, buffalo hump. Okay, and the rupture of the skin occurs due to stretching, because of which the purple striae appears on the abdomen. Okay, these are the important points you have to put forward for the fat metabolism, of why the moon-like faces occur, why the buffalo hump occurs, and why there is purple striae on the abdomen. Okay, because it plays a very important role in redistribution of the fat at the expense of the extremities, and centripetal distribution of the fat occurs. That's the reason all these features occur if the glucocorticoids are not within their limits. Okay, next, it also very helpful in maintaining the electrolyte and the water balance, and in the blood plays a very important role as well. Okay, so in the GIT, it increases the gastric acid and the pepsin secretion. It also decreases the gastric mucosal cell proliferation, and which thus produce the peptic ulcer formation if it is not within its limit. And on the CNS, excess glucocorticoids decrease the threshold of the excitation of the electrical stimulus of the brain, because of which it can produce convulsions. So these are the various pharmacological actions. So you have to put forward, and if you can draw this diagram of how it has the of how it shows the anti-inflammatory and the immunosuppressive effects, that will be really adding to your marks. So draw this if you can. Okay, so how it shows the anti-inflammatory and the immunosuppressive effects. So coming to the mineral corticoids, so aldosterone is the most important mineral corticoid, which helps in preservation of the sodium and the it maintains the water balance, sodium and the water balance. So it's decrease. If there is a decrease in the aldosterone, then it causes hypotension, dehydration, circulatory collapse, and finally death. That's the reason it is called as a life-saving hormone. Okay, you can put all these points and you can highlight. So it's mainly important for the sodium and water retention, so that you can put forward. So again, if it is asked as a essay question, so for aldosterone, it's better to write the renin-angiotensin mechanism. So renin-angiotensin mechanism, if you can put forward this, it's very good. So angiotensinogen, which is produced by the liver, it's converted to angiotensin 1 in presence of renin, which is produced by the kidney. Then angiotensin 1 is converted to angiotensin 2 by the presence of the enzyme, that is angiotensin converting enzyme, that finally acts on the receptors and produces this aldosterone by the adrenal gland. This aldosterone plays a very important role in retention of this water and sodium. So that plays a very important role in regulating the blood pressure of the body. So if you put forward all these points, that will be really fetching for you. Okay, so this is how you have to start with the answer, and then you have to come for the classification of the drugs. So the short acting drugs, which in the glucocorticoids, the short acting, the intermediate acting, and the long acting. So these you have to write, it's very important. And the mineral corticoids you have to write. Okay, so you have already discuss the pharmacological actions. So these are the various adverse effects. So this is a mnemonic actually, which if you can try to remember this mnemonic. Okay, so the glucocorticoids, the mnemonic has its answer. So glaucoma, the muscle atrophy, the ulcers, the Cushing syndrome, the osteoporosis, the cataracts on systemic use, and the osteonecrosis, and it's contraindicated, completely contraindicated in renal failure, and also in contraindicated in tuberculosis, and also contraindicated in congestive heart failure, the impaired wound healing, the edema, the infections, and diabetes mellitus, and also suppression of the HPA axis. Okay, so how it suppresses is, for example, if the cortisol levels are much beyond the limit, then as I said, it sends a signal to the hypothalamus. So since it's more than the limit, so it sends a signal to the hypothalamus to stop the production of the CRH. So there is a reduced production of the CRH, because of which the ACTH is also less produced. That's the reason there will be no signal that is to be released by the adrenal gland. So signal from the pituitary gland will not be going to the adrenal gland. That's the reason it ends up with adrenal insufficiency or adrenal crisis. So that's very important. So that you have to highlight. So if the cortisol or if the drugs dosages, if you give long-term usage of corticosteroids, and if the dosage of the drugs is not properly monitored, then it results in adrenal crisis, because it sends a signal to the hypothalamus, followed to the pituitary gland, followed to the adrenal gland. So if the CRH is not produced, then again ACTH is not produced, and finally the adrenal gland cannot produce its own cortisol. So the person will completely be on the artificial corticosteroids that we give. That's not reliable. So the body should also produce its own corticosteroids. That's the reason when we prescribe corticosteroids, after a particular dosage time, we give an alternate day basis, so that on the alternate day the natural stimulation of the body occurs. So the natural production of the corticosteroids occur. So one day we give our dose, the other day the body produces. So this is how you have to maintain the HPA axis, and this is how you have to prevent the adrenal crisis. Okay, so Cushing syndrome, see, I have an idea of this picture and write the symptoms. That's it, the entire symptoms from the head to toe. See, have a look of this picture and you can write. Okay, and if there is less corticosteroids or decrease or deficiency, then it results in Addison's disease. So have a look of this diagram and write the symptoms. Okay, if it is more, then it results in Cushing syndrome. If it is less or deficiency, it results in Addison's disease. Okay, so therapeutic uses in dentistry. So every question, pharmacologic aspect, write the applied aspects. So in especially in dentistry, it is used in all these ways. Okay, so especially for the aphthous ulcers and any autoimmune diseases like lichen planus or erythema multiforme, pemphigus, all these you can give steroids because it has its very good property of having anti-inflammatory action. So for oral lesions, you have to start with topical corticosteroids. So topical steroids are very important. So if it is asked in oral medicine, do mention these steroids along with the dosages. The dosages are very important for oral medicine students. Okay, so you have to write these specific dosages, especially for the triamcinolone and the clobetasol. These two are very important, so do note. So 0.1 for the triamcinolone and 0.05 for clobetasol propanoate. Okay, and again adverse effects for the topical steroids you need to write. So it could be the local like the bruising or dermal atrophy or hyperpigmentation, delay in wound healing, and also fungal and bacterial infections. So opportunistic infections actually occur if there is a long-term usage of steroids, but topical steroids will not cause much of systemic effects. So the topical effects you can write. So this is how you have to write your answer. Applied aspects, oral medicine students, they have to write more. So if you can write the dosages of the drugs in individual autoimmune diseases. So autoimmune diseases, corticosteroids have the immunosuppressive action. So because of which they can be used in autoimmune diseases like lichen planus, pemphigus, SLE, all these diseases you can write. Okay, and apart from that, the aphthous ulcers you can give the triamcinolone acetonide topically 0.1%. So you have to elaborate your answer by writing your applied aspects. So not only the headings, you have to write individual description of that particular disease and how the corticosteroids act in that disease. So like that you have to enhance and increase your answer. That's it. So and references, you can give your pharmacological textbook, the Triparty, that's enough. So main textbook you have to give that, and Burkitt textbook you can give. So like the clinical aspects you have taken from Burkitt karke you can give. Okay, any articles if you can give, it's enough. That's enough for this particular chapter of corticosteroids. Okay, so main thing, where all diagrams are required and where all flow charts you can give, if you can give those, that's enough. So the heart of the answer actually lies in the actions of the glucocorticoids and the mineral corticoids actions, as well as the classification of the drugs and the important side effects, the Cushing syndrome and the Cushing syndrome, all those important side effects from the head to toe, and the Addison's disease. So this is how you have to start and end your answer. And finally the applied aspects, especially in dentistry. So that's it. Okay, and if it is for oral surgery students, then it is again important to write for the stress management. If you have to extract many multiple extractions on one day, then you give corticosteroids as a prophylactic use to manage the stress. So like that you can answer for the oral surgery students. So where all related to your own particular department, if you write the applied aspects, it's very useful for you. That's it. Okay, thank you.